A question was asked by one of the MBBS students as to why there is bradycardia in patients of trigeminal neuralgia. This short video explains the possible reason of bradycardia in patients suffering from trigeminal neuralgia. Firstly, briefly about trigeminal neuralgia. It is a chronic condition usually seen in people over 50 years of age and is more common in women. The patient experiences intense, excruciating shock-like facial pain which lasts for a few seconds to a few minutes. The pain is in the distribution of trigeminal nerve in either of the three sensory divisions, the ophthalmic division, the maxillary division, or the mandibular division. Typically, the pain involves lower face and jaw. Sometimes the area around the nose or above the eye may be affected. This pain is usually limited to only one side of the face. The pain represents irritation of the trigeminal nerve and is usually due to compression of the nerve near brainstem by a blood vessel, a tumor, or AV malformation. Trigeminal neuralgia, when seen in younger patients, suggests multiple sclerosis. Now, coming to the bradycardia. Well, this finding has not been widely reported in the literature in patients of trigeminal neuralgia. On search of literature, only one report was found. In this report, an elderly patient who came with trigeminal neuralgia was connected to the monitor as per the hospital protocol. This patient had intermittent sinus bradycardia with periods of asystolic pauses lasting 3 to 20 seconds. And these cardiac changes coincided with bursts of electric pain of the face. On the other hand, bradycardia has been widely reported in patients undergoing surgical procedure at the base of skull, brainstem, or in any of the three distributions of the trigeminal nerve. This phenomena has been named trigeminal cardiac reflex. Our bradycardia seen in trigeminal neuralgia patient is also most likely due to excess vagal tone as a result of trigeminal cardiac reflex. So this discussion comes to the trigeminal cardiac reflex. The trigeminal cardiac reflex is a brainstem reflex related to stimulation of any of the sensory divisions of trigeminal nerve or the Gasserian ganglion. It is a triad of bradycardia, bradypnea, and increased gastric motility. This phenomena of trigeminal cardiac reflex is observed only in 10 to 20% patients undergoing surgical procedures at the base of skull, brainstem, or in the distribution of trigeminal nerve, and possibly in trigeminal neuralgia too. Bradycardia is seen in only 10 to 20% patients. The pathway of trigeminal cardiac reflex is firstly the afferents. The afferent impulses arise either due to stimulation of temperature, stretch, or pain receptors, or they may be triggered by direct stimulation of the sensory nerve or the sensory part of Gasserian ganglion. These afferent impulses travel via branches of trigeminal nerve to the Gasserian ganglion. From the Gasserian ganglion, these impulses they go into the sensory nucleus of trigeminal nerve located in the brainstem, and from the sensory nucleus to the adjoining reticular formation. Sensory nucleus of trigeminal nerve and the reticular formation is called the central integrating unit of the trigeminal cardiac reflex. The efferents emerge from the reticular formation via short internuncial fibers and project to the motor nucleus of vagus, the nucleus ambiguus, which is not shown in this figure, and they also project to the nucleus parabrachialis and rostral ventrolateral medulla. From the motor nucleus of vagus and the nucleus ambiguous, these efferent impulses travel via the vagus nerve to the effector organs, and the efferents arising from the rostral ventrolateral medulla and other respiratory nuclei travel via the sympathetic fibers and other spinal nerves and phrenic nerve to the respiratory muscles. The effectors are the heart via the vagal parasympathetic fibers. We see bradycardia, asystole, and arrhythmias in the heart. Now, in addition to the stimulation of the vagus, there is sympathetic inhibition seen via the rostral ventrolateral medulla and the sympathetic chain pathway. Now, this might also cause negative inotropic effect on the heart. The gastrointestinal tract is affected via the vagal parasympathetic fibers, causing increased gastric motility. The blood vessels, the peripheral blood vessels are affected via the sympathetic fibers. There is a reduction in the sympathetic tone which causes vasodilation and that leads to hypotension. In addition to the peripheral vasodilation, cerebral vasodilation is also observed. The respiratory system is affected via the nucleus parabrachialis and other respiratory nuclei, ultimately leading to decreased respiratory rate and apnea. To summarize the trigeminal cardiac reflex pathway, the afferents traveling via the trigeminal nerve go to Gasserian ganglion, and these afferents enter the sensory nucleus of trigeminal nerve and reticular formation, which are the central integrating units. From the reticular formation, efferents emerge via short internuncial fibers, ultimately going to the motor nucleus of vagus and other nuclei in the brainstem. Ultimate effects are produced via the vagus, phrenic nerve, and the sympathetic fibers. The answer to the question is that bradycardia and trigeminal neuralgia is due to stimulation of the vagal motor nucleus and nucleus ambiguous due to triggering of trigeminal cardiac reflex, and this bradycardia is not seen in all the patients of trigeminal neuralgia.